So I'll go ahead and turn off my camera now just to help minimize the distraction. And I would like to ask if you can hold off from asking questions just towards for the end of our presentation. We will do a walkthrough on everything that you have access to and are eligible for as a graduate student employee of the university, working as an RA or TA or GA. So we're going to do an overview on the employee benefits piece, and then we're also going to walk you through an overview on the student health side, and Lori will also do a demo for us, and then towards the end we will do a question Q&A session. Well, first and foremost, we want to obviously congratulate you and welcome you to UTD, especially if this is, if you're new to the university, or maybe you are a new benefits eligible employee because you're now working in a RATA or GA position. So we're very, very happy to have you here at the university, and we do believe that we have the best of the best students here with us. And so as such, we want you to have access to awesome benefits. That way you don't have to worry about, having coverage, and you can just focus on your studies. And of course, we believe that our students change the world. We do want to just be able to walk you through, you are in a very unique position as an RATA or GA. And the best way that we can describe it to you is that you are serving in a hybrid role. The reason you're considered hybrid is because you're a student of the university, but when you're hired for 20 hours per week as a part-time position, you are also considered a benefits eligible employee of the university. And in this hybrid position, when you serve both as a student because you're taking classes, but you're also working here in a benefits eligible job, you are eligible for two separate category of benefits. Benefits that are generally only available for students because of your student status, as well as benefits that are only available for benefits eligible employees. So we want to just do an overview of both to try to make it clear, how both of them work, what the enrollment process is with both, who your resources are for either of those categories. That way, you know who to contact with any questions. As far as the most popular plans that are RA, TA, and GAs that are hired for 20 hours per week typically choose is the university is now paying for students in that position, where the UTD is paying for your student health insurance plan, which we call SHIP. We use the acronym SHIP for short. And the UTD SHIP plan is medical coverage that is available for students. And when you're hired as a RATA for 20 hours a week, you are eligible to receive that insurance completely free. So it's provided to you at no cost. And there's also no action required for you to enroll in that specific free medical plan. Now, if you wanted to add any dependents to your student medical plan, whether it's an eligible spouse or children, at that point there would be a cost. But if you're only providing coverage for yourself, the university is paying for that 100% for you. So you get free student health medical coverage. So that's on the student side. Now, the popular choice that our students select who decide, I'm going to keep I'm definitely interested in having the free student health plan, is if you're enrolled in the free student health plan, you qualify for free dental, vision, and accidental death and dismemberment benefits on the employee side. And so that combination of free medical that's offered through the student health, and then free dental, vision, and AD&D offered on the employee side, that combination is the most popular plan that our students tend to select because you have free medical insurance, free dental, vision, and AD&D. Now, unlike the student health plan in which you're automatically enrolled, on the employee side, you do have to take action. And so we're going to walk you through that so you know what steps are required to enroll. So again, just a snapshot of our agenda. So we've slightly gone over your hybrid position, and then we're going to jump over into the employee benefits piece. And we'll do a demo we'll do a walkthrough of your enrollment tutorial, and then we will, um, at the end, have the resources listed and take some questions and answers. Okay, so just to do a little bit more explaining on your hybrid position. So again, if you're an RATA or GA hired for 20 hours a week, you're serving in a hybrid role. It's hybrid because on the student, because of your student status, students have access to a medical plan that's only available for students called SHIP. And if you're working in this position, you qualify for free medical SHIP coverage. The enrollment process for that is you have no action to take to enroll in the free SHIP. That is completed for you automatically and is driven by your onboarding process. The only time you would have to take action for that part is if you wanted to add spouse or children to your plan, or if you decided that you are not interested in the free SHIP coverage, you do have options to opt out. So you would have to take steps if you wanted to waive that free student health medical plan. The resources for student benefits, we have folks at the bursar's office that can assist with enrollment questions. We also have an on-site UTD student health insurance office available to help with any questions that you may have on how the insurance plan works, or things like, what are my resources, how do I get a ID card. Then the plan administrator for the student health plan is known as academic health. So they are another resource for you. And then we also have, there's a general inbox called RATA ship at utdallas.edu, where you can send questions about the enrollment process as well. Okay, so that in a nutshell is an overview on the student benefits piece of it. Now, again, you're in a hybrid role, so you also qualify for a totally different set of benefits on the employee side. So on the employee side, because you're an eligible employee, you technically also have access to all of the employee benefit plans, including the medical, right? But on the employee side, the medical insurance, if you were to prefer that one would not be free. So only the student health plan is free for those enrolled as student only. But on the employee side, even though technically you have that choice, if you preferred the employee plan, you would have to, waive out of your free student plan, select the employee plan, and pay a monthly premium that would be just over $300 per month. Again, the most popular one that our students tend to choose is the free student medical plan because it is a very rich plan. So it's got great coverage. And then, of course, there's no out-of-pocket expense for you compared to the employee one that would have an out-of-pocket expense. And on the employee side, we also offer dental, vision, flexible spending accounts. There's life insurance if you wanted to enroll in that and pay for these extra plans. And then there's also disability coverage. So again, because you're an employee working for the university, you can access any of those benefits that you're interested in. Now, as far as the enrollment process for the employee benefits, our process is a little bit different than the student side of the house. So for the employee benefits, there is no automatic enrollment. So if you are interested in any of the employee plans, you do have to log in to the employee benefits portal, which is called My UT Benefits, and there's a deadline to enroll. So the deadline is 31 days from your hire date. So you have to complete your enrollment within that window if you want any of the employee benefits. And then again, just to touch on the most popular, package, if you will, that our students like to take advantage of is a lot of them prefer to keep the free student medical plan because it's a great plan, it's free. And if you keep that plan, you qualify for a benefit that's available to employees, which is called the Premium Sharing Credit Plan. This premium sharing credit plan, the university typically offers it to employees who say, I don't need the UTD employee medical plan because I already have coverage somewhere else, right? Whether it's the student health medical coverage that you already have, or if you were still enrolled on maybe your parents' plan through your parents' employer, or you're married and you're covered through your spouse's employer plan. And so if you say, I don't need the employee medical and I have coverage outside, then you qualify for the premium sharing credit plan, which can offer you free dental, free vision, and AD&D benefits. But again, even if you want those free benefits, you have to log in within your 31 days of hire to select those plans. As far as your contacts and resources for the employee benefits, that's where the human resources department comes in. So the HR department at the campus, we are here to serve the staff of the university, the faculty, and our graduate student employees such as yourself. So you're always welcome to contact our team at the benefits@utdallas.edu inbox. All right, so now again, just an overview of everything that you qualify for on the employee side. Of course, you have access to everything that benefits eligible employees do at UTD. So just a friendly reminder, because sometimes we do have some of our graduate students that um, make some mistakes and they log into the portal and maybe did not intend to enroll in the employee medical plan. So again, just a reminder that if you prefer the free student plan, you would want to make sure not to log into the employee portal and select one of the employee plans, which is UT Select and UT Connect. If again, but that's up to you if you decided that you preferred ours instead of the free one, but you would have to make sure to waive and opt out of your free one and then realize that the employee plans are not free. So those would deduct again at least $337 from your paycheck each month. Um, and then you have access to the other benefit plans as well that are listed on our little graphic there. All right, so let's talk a little bit more about this premium sharing credit plan. So if you decide, okay, I'm a graduate student and I want everything that's free. I just want all the free stuff, right? What do I need to do? Okay, so if you just want all the free benefits for now, then obviously the student health plan for your medical coverage is the free one for your medical. And then on the employee side, you're going to want to do the premium sharing credit plan. And basically, this plan, the way that you get these free benefits is that the plan offers you a total of $168.79 per month in credits. And those are the credits that you can use to help cover the cost of the employee dental, vision, and AD&D premiums. And since most of our students are only providing insurance coverage for themselves, that $168 that you qualify for each month tends to be more than enough to pay for the cost of you to enroll in the highest and most expensive dental plan that we offer, which is Dental Plus. You can enroll in the most expensive vision plan that we offer, which is Vision Plus, and you can enroll in the maximum benefit of the AD&D. And when you add that total of those three plans together, it's usually less than your $168 credit that you qualify for, and that's how those plans end up being free for you. Um, and so if you want to go ahead and go down that route, we're going to do an enrollment tutorial here shortly to show you what steps you have to do to take advantage of this premium sharing credit plan. So to do your enrollment for the employee premium sharing credit plan, these are the steps that you would take. So you would start from the UT Dallas homepage and hover over the resources menu and select the Galaxy login. On the next page, you would click on Gemini. Once you're on the Gemini page, there's going to be a menu where you can click on the Gemini for departments. And on the next page following that, you're going to look for a tile that is called the self-service tile. Once you click that tile, you're going to look for the next tile, which is called the My UT Benefits. My UT Benefits is the enrollment portal for the employee benefit plans. After clicking the My UT Benefits tile, you'll see this splash page pop up. and it's asking you to enter your organization's name. So you type in University of Texas at Dallas and hit continue. Next, it's going to prompt you to log in with your SSO, which is your net ID and your main employee UTD login password. And it should prompt you also to complete your duo authentication just for security purposes. Once you complete your duo, it's going to take you to a splash page where it'll have a welcome banner, and you'll want to click on that blue Enroll Now button. That will launch you into the main My UT Benefits page. And again, you'll see a welcome banner across the top, and you'll want to click on the blue Get Started button. If it's your first time logging in there, it's going to present a profile page. And on this page, we just ask, for you to double check that the information as far as your name and address and phone number and such are correct. If it's incorrect, you would have to log back in to the Galaxy page to make those updates. So you wouldn't actually make the updates on this profile page. This is just a preview of what's in our database. And if it's incorrect, you can update your address through Galaxy. And we have those steps also included in this tutorial at the end. So you'll have that if you need to make your address. We do tend to find out, from our student employees, since you also you access the Orion system, right, for your student records. Sometimes our students will say, well, my address is correct in Orion, but the Orion platform is a separate platform from those that the employees of the university are on. So Orion is everything for your student records. And if you ever make updates to your information in Orion, you'll need to remember to also log into Gemini so that from an employee perspective, we can also have your most up-to-date information. And it's important that your address is up to date because that's where the address that you see on this page is where your ID cards for the dental and vision, any other benefits you choose would be mailed to. Once you preview your profile page, it's going to prompt you to add any dependents if you're planning to add eligible dependents to your plan, such as your spouse or children. If you're not going to add anybody, you can skip this, but if you do intend to add somebody, here's where you would add their information. And then keep in mind when you add eligible dependents such as spouse or children, their enrollment will be in a pending status until you upload documentation to confirm the eligibility, such as a marriage certificate for your spouse or a birth certificate for your children. If you have a marriage certificate that's in a foreign language, we will accept it on a temporary basis, and we do ask that you provide a certified translated copy. Next, in the enrollment workflow, it's going to ask you whether you are a tobacco user. So if you're not a tobacco user, you would answer no. The system, it will also ask if you are covered under Medicare. So that generally applies to people who are age 65 and over or under 65 and have coverage through Medicare due to a disability. But if that does not apply to you, then just answer no and continue. Now, if you're an RATA or GA working 20 hours a week as a new hire, in our employee benefits system, it does automatically have the premium sharing credit plan selected for you, and we never auto enroll you in the medical plan. So that's going to also show that there's no coverage on the employee medical. And again, if you want all free benefits, then that's what you're looking for. And so to continue with your dental and vision and AD&D to get those for free, in the current benefits list, it's going to show you the dental plan is listed as number 3. And so you'll want to click Begin Enrollment. And on the next screen, it's going to show you all of the dental plans that we offer. So the university actually has 3 different dental plans because they offer different types of coverage. And based on the coverage that they offer, they have different monthly costs that employees pay. Now, because of your position, you qualify, if you prefer, you can have the highest of those 3 plans, the ones with the most coverage, which is called our UT Select Dental Plus plan. and you would still qualify to get even the most expensive plan. That one's usually about $61 a month for the employees who pay for it. But if you qualify to get it for free, you can get Dental Plus and still pay nothing. So if you want the one with the highest benefit, since it's free for you, you would want to choose the Dental Plus plan. The other two plans have less coverage than that one. Once you select your dental, it's going to show you this summary page, and you'll just click the green Save button to move on. It will then bring you back to the enrollment workflow, and the next benefit on the list is going to be your vision coverage. So that's another one of the benefits you can get for free. So if you're interested in free vision, you would click the blue Begin Enrollment button. The university has two different vision plans available. We have a standard plan, and then there's a plan called the Plus plan that offers a higher benefit. And again, in your position, it's up to you to choose which one you prefer. If you want the one with the most benefit, since it's going to be free for you anyway, you can get the Plus plan, and it would still be free for you. So you could hit select plan, and it's going to change it to currently selected. And then once you go back into the enrollment workflow, the system will ask you if you want to enroll or decline in what's called our healthcare FSA plans and dependent care FSA plans. Again, because you're a benefits eligible employee, it's totally up to you if you want to add other plans. If you do add other plans, there is going to be a cost deducted for those from your employee paycheck each month. The only ones that you qualify to get for free are dental, vision, and AD&D. Anything else you enroll in, totally fine. Just know that there will be an out-of-pocket cost for those. So the healthcare FSA plan is generally if you want to receive a debit card in the mail where you choose how much money to load on that card, and that card can then be used to help you pay for medical expenses, your own medical expenses, pharmacy expenses, any out-of-pocket dental, vision expenses that you may have. So it's going to be up to you to decide how much money you want to load on that card. The IRS is the one who determines the maximum that you can load. So the minimum is $180 total, and the maximum is, $2,850, but you can pick a range between there. Just keep in mind that with this benefit, there's an IRS rule called use it or lose it, where if you enroll in that plan and you don't use all of the money that you enrolled in, you run the risk of forfeiting that money. So if you're interested in learning more about that, feel free to email us at the benefits inbox, and we can explain that a little bit further in detail if you're interested in it. If at this time you just want to take advantage of everything that's free, then you would decline the healthcare FSA card. Dependent care is for employees who have children age 14 and under, that you have daycare expenses for the children, or before school, after school programs, things of that nature. It's almost like having a separate savings account where you have money deducted from your paycheck that goes into this dependent care savings account, and then you can use that money to help reimburse yourself for daycare expenses. So if that does not apply to you, if you don't have kids 14 and under that you have daycare expenses for and things of that nature, you would want to make sure you decline this plan and not enroll in it in error. Next on the workflow, it's going to ask if you want to enroll in the AD&D plan. So of the free benefits, again, it's dental, vision, and AD&D. So this is the third of the free benefits that you could get. And again, since it's free for you, you can choose the highest coverage plan for this benefit, which is 10 times your salary. So you can elect that, which is going to be at the top of the page. And again, it would be provided to you at no cost. For that AD&D plan, it does require that you add a beneficiary in the event of your death due to an accidental death. that benefit amount would get paid out to whoever you designated as a beneficiary. So it's important for you to add this information. It could be family. It doesn't have to be somebody that lives in the U.S. And so on the next page, it will walk you through that process to add a beneficiary. If you only add one person, then for the beneficiary type, you would make them the primary. And then for the allocation, which is basically asking how much of the money goes to them, you would input 100, meaning 100% of the benefit would go to that primary beneficiary. If you are interested in adding more than one beneficiary, that's totally an option. You would just add those rows. You can indicate several people to be primary and then evenly distribute that 100% across them, or you have the flexibility to choose if you want somebody to get more than others. Um, and then once you input your beneficiary information, you would hit next. And then the last benefits in the enrollment workflow will be the long-term disability coverage and short-term disability coverage. So again, these benefits you qualify for, but these would not be free. If you're interested in those plans, just keep in mind you would have a monthly cost deducted from your paycheck. But again, if you only want to take advantage of everything that's free, you would just decline these and then hit your green complete enrollment button. You will then see a congratulations banner flash across the screen, confirming that you've completed your enrollment. On the following page, if it's your first time ever going through this process, the system will prompt you to complete a previous state employment survey, which is a short 14-question survey. So you can just answer those questions, yes or no. And then at the end of that survey, there's a feedback question that will pop up about the enrollment process. So that would complete you selecting your benefits. And then if you're somebody that's going to add a spouse or children or the whole family, just keep in mind their enrollment is going to be in pending status because you do have to upload documentation such as marriage certificate or birth certificate. So if that applies to you, once you complete your enrollment, on the home page of My UT Benefits, there's going to be a menu on the upper right-hand corner. You will hover over Profile and click the Document Center and upload those documents. Now, once you've completed everything, the way that you can see a summary of everything that you enrolled in is, again, from that home page, you would hover over the Benefits tab and click on the confirmation statement. The confirmation statement you can access at any time of the year, and it's always a summary of what your active employee benefits are. So this is, again, just your employee benefits. It's not going to show you the student benefits, such as the medical student health plan. This is strictly just your employee plans. It will have your name and address at the top. It will also show you the total monthly out-of-pocket costs. And if you qualify for the premium sharing credit plan and you enrolled in just the free benefits, which is dental, vision, and AD&D, this is what your statement would look like. Okay, you'll see those benefits with the little green checkbox. They'll have an effective date, and then they should also show a zero out-of-pocket costs because you qualify for those free plans. So this is how you can just confirm that your enrollment is correct. And just some important reminders for the employee benefits. You do have a 31-day enrollment window from your hire date, so make sure not to miss that if you want to enroll in our plans. And then as far as uploading your marriage documents or birth certificate documents for adding family members, that deadline is 45 days after your hire date to upload those documents. And just a reminder again, although the student health plan automatically enrolls you on their side, for employee benefits, our enrollments are never automatic. So you do have to take action, even if you want to just do the free benefits. And again, just with your student status, all of your student records are basically housed on the Orion side. So any updates you make with your address and such on Orion, just remember you'll have to log into Galaxy to make sure that your employee records are also updated. And then we will have the steps on how to upload, correct your address on the employee side here on this slide. So you can always refer to this, which will be posted on our website. And then you have quite a few resources available at the university to help you, navigate any of this process. So again, just keep in mind the two categories in your mind, right? You have your student benefits, and those have specific contacts and resources. So we have the bursar's office that helps with enrollment. You have the plan administrator, academic health plans that can help also answer questions on coverage, how the insurance works, helping you find doctors that you can use your student health plan to go have a visit with. And then, of course, there's an on campus UTD student health insurance office as well that's available to help you also with questions about the student health insurance plan. If you had any questions, we also have an on site student health care clinic, but those are things that the UTD SHIP team can help explain to you and make you aware of the resources that are on campus for you. And then on the employee side of the house, you have the Human Resources Department Employee Benefits team. So we're here to help answer any questions about your eligibility for employee benefits. And then we also have a dedicated website on our HR page that's called the Graduate Student Insurance website. So we will post this recording on that page. We also have a PDF instruction guide of how to complete your enrollment in the employee benefits. We have frequently asked questions on our website. So it's a great resource for you to review. And if you have any feedback, we're always eager and happy to take any feedback from you all. Um, because of your unique hybrid position, sometimes we understand that it can be a little bit confusing because, but again, it's because of you have access to student benefits, and then you also have access to employee benefits. But hopefully today's presentation kind of just outlined it in terms that are easy to understand and follow. So if there's anything that as you're going through your process that's confusing or that you think we could tweak and make it better for other students, please do share that information. We're always happy to modify anything that you all from your perspective think will help this process make more sense or be easier for other students in the future. And with that, I'm going to turn it over now to our friend Lori Jacobson, who's joining us from the bursar's office, and she serves as part of the RATA SHIP team to assist with enrollment questions, and she's going to do a demo for you. And again, if you can hold your questions after she completes her piece, and then we will then be happy to take any questions.
Hi, everybody. My name is Lori Jacobson, and I am with the bursar's office. I primarily manage the student health insurance plan enrollment just for the RATAs and GAs. So I'm going to start with a little bit of information on what to expect as you are enrolled into the student health insurance plan, because it is an automatic enrollment. Some resources that you have about the student health insurance plan, and then I'm going to just walk through the academic health plan's website so that you can find where you can enroll your dependents, as well as waive the student health insurance coverage if you want to do that. Just a little bit of information. I'm not going to go too much into this, but there are 4 positions which qualify for UTD to pay for your student health insurance plan for your premiums each month. You do need to be in one of these positions and working 0.5 FTE or 20 hours a week to remain eligible. Once you are hired and you're in the HR system, we automatically enroll you then into the student health insurance plan. There isn't anything that you need to do to enroll yourself into the plan. I know sometimes some students are confused that this part that they have to enroll themselves, like you would need to do on the employee side under UT benefits, but we auto enroll you into this. You will see some accounting posted to your student account. Basically, it's for internal purposes that we know that you are we are covering you on the student health insurance plan, but there's a charge and then a waiver. So there's nothing that's going to be billed by UTD for this for the free insurance. And you will see that a non-taxable benefit under the employee paid benefits section on your paycheck. Academic Health Plans is going to send out a welcome email, registration email with instructions on how to enroll your dependents or request to waive the student health insurance plan. Most of you have already probably received that. There may be a few people who are still in the process of being hired and have their information entered into the HR system, and that would be why you wouldn't have received the email yet. But I'll give you my contact information in a little bit if you do have concerns if you haven't received that email. Academic Health Plans is the broker who administers the enrollment for the student health insurance plan. And so if there are any questions you have on the documents you've uploaded or questions on your waiver, they would be the ones to contact to help you through their website. They are at 1-855-247-7587. Now, Academic Health Plans has just converted their website, which I'll show you after these slides, to the next plan year's data. So they have archived the data for 22-23, and the plan year for student health insurance runs right now we're 8/1/22 through July 31st of this year. So I will show you where to go to add your dependents or waive the student health insurance if you want. Again, AHP is going to send out registration emails with a link to add them. And you do pay them directly for your dependent coverage if you are enrolling a spouse or children. One thing that is different from UT benefits, if everyone that is working through July 31st, actively working, you will be re-enrolled into the next year's plan. And that is also for anyone who waives the student health insurance at this time. Everyone is re-enrolled and active on 8/1. And at that point, you would have the opportunity to, again, enroll your dependents for the next plan year and or waive out of the student health insurance plan. The waiver is required when you are enrolling in UT Select or UT Connect. So you can't be enrolled in UT SHIP and one of the other UT benefits on the employee side. If you have outside group coverage and you want to keep SHIP, that is perfectly fine. It's only if you select to enroll in UT Select or UT Connect and pay for that employee insurance that you must waive the student health insurance plan. Now, because they have changed over their website in the last couple days, I put a link on the top there for the current plan year's waiver link for 2022-2023. You can see the dates there through July 31st. That page will have the link to that waiver. And then the upcoming page, upcoming plan year, I've put the waiver link to that. Let's see, I believe I just went over this. When the new year plan starts, you must request a waive for the new plan year again. And we will be sending out more information on this in late June. So your resources, and I know Pearl had gone over some of this already. The bursar's office does have that web page with some more information on the student health insurance plan for the RATA GAs. And it includes everything like how can I get my insurance card if you don't receive it, eligibility requirements, what you're eligible for once you leave UTD, you graduate. They do have a 3 months continuation enrollment coverage once you do graduate, and you can enroll in SHIP for those 3 months through AHP. And there are other enrollment situations where we have more information on our webpage. Now, the Student Health Center, they are a good resource, as Pearl said, for if you need some information on what the student health insurance does cover and benefits, as well as the Academic Health Plan's website. And I've put my contact information here, rataship@utdallas.edu, if you have some questions just on the enrollment process itself. Questions on how to enroll your dependents or waive the SHIP coverage. If you go in there and onto the website and enroll your dependents and you have a question at that point with their website, this is the number to call them and get some confirmation on what you need to do. But it is basically the same of uploading a birth certificate or marriage certificate for your dependents. And of course, I have the phone number here for Blue Cross Blue Shield of Texas if you have questions on the coverage once you're enrolled. So on the websites that I wanted to show you for academic health plans, it's utdallas.myahpcare.com. And when you go to the website, they have converted it over to next plan year already, which starts 8/1. If you scroll down, you'll see that they have archived everything for the current plan year below here. If you click on that and you scroll down, you will have all your benefit information about the plan, the highlight flyer, the master policy, and the summary of benefits coverage. The dental is not included in the student health insurance plan that UTD is enrolling you in. If you scroll down a little bit further, you'll see you have the RATA part-time employees enroll dependents. So on this archived page, you'll have the link to enroll your dependents for this current plan year. Below that are the waiver requirements. Now, international students and domestic students enrolling in the UT Select or UT Connect plans with UTD, that is all that you really need for to show for waiving the SHIP coverage. If you're going to select one of those two plans and pay for your health insurance instead of take advantage of the free health insurance. And you would use this link here, regardless if you're an international student or domestic student. This, just so everyone knows, is really for the international term insurance, which you would not be using as an RATA. Once we move over to the next plan year, which will come up very soon, then you have your links here to the waiver and enrollment for the next plan year starting 8/1. I did also want to show you that the bursar office, we have a bunch of information here on the RATA student health insurance program. The Student Health Center is also your resource, as Pearl's mentioned, on asking about your coverage and other benefits that come with the student health insurance. and their contact is listed under the student health insurance on this webpage. So if you do have any questions after today, you can just email me at rataship@utdallas.edu. Thank you. Pearl, I'll hand it back off to you.
Thank you, Lori. Well, that brings us to the end of our presentation. So we are happy to take any questions. And let's see. If anybody has any questions, feel free to unmute or type in our chat. And I think with this particular setup in Microsoft Teams, I may have to unmute all. So let me try that just in case you're trying to unmute and it's not allowing you to. Let's hit that. Okay. Somebody on my team did it. Thank you. All right. I think now if anybody was trying to unmute, it should allow you to unmute now. No questions? Does that mean we made it easy? Hopefully. Okay. Well, if there's not any questions, again, we're going to post this recording to our website. So if you want to go back and if maybe you didn't have a chance to follow along with the enrollment tutorial today, you can do so, using this recorded presentation on the website. And then just a reminder, we do have also a PDF enrollment guide posted online. So you'll have those resources, but if there's any questions that you think of, feel free to reach out to Lori using the RATA ship email address, or you can reach out to us as well, benefits@utdallas.edu. And again, if you don't mind, if there's any feedback that you can share with us, we're very, very eager to learn how we can make this process, whether if you have any good feedback to share, like, yeah, this was helpful and this made sense to me, or any constructive feedback, hey, this is confusing, or I think it'd help us as students if we had such and such. Again, we're always eager to learn from you all to see what we can do to make it better.